So you teach this digital workflow course.
Right.
And you offer 3 or 4 or more courses.
Right.
So tell us a little bit about this course. What could people expect?
Well, the Atlantic Implant Institute, Virginia Beach, Virginia. Usually, we teach courses. Usually they're 2.5 day courses. Our flagship course is the full arch, full digital workflow. We teach you how to bring in a patient and do the entire procedure without models, start to finish, in just a day. Well, the course is 2.5 days, but how to treat a patient in 1 day. Okay. We do live patient demonstrations in the classroom, in front of the classroom. We have a surgical operatory called the Octagon. I love it. Viewing in 360 degrees, windows all around, but room enough. We're not just doing this in an operatory in my office. This Octagon is big enough for 25 doctors to stand in comfortably. So we've got that, the full arch, full digital workflow. We've also got stackable guide modules. If you're a beginner doc or you're a doctor who believes in stackable guides, we can teach you that workflow. We've also got atrophic arches, how to treat people. I don't know if you know this, but probably 30 or 40% of patients in the maxilla, they can't be treated in all-on-4 with just standard implants. They need zygomas. They need some kind of pterygoid. Okay. So we teach how to do that as well. We've got a business course for how to 5, 10, 20, how to get your practice to 5 arches, 10 arches, 20 arches a month. And we teach you everything from advertising to logistics and how to schedule and the instrumentation you need. So we've got, all these courses teach a component of Instarisa, which are our good friends in Fresno. We've got an Instarisa course for itself, 2 days, but we also put bits and pieces of Instarisa into the other modules.
And the Instarisa, for some of the people that are watching this to know, is what?
Instarisa is essentially 2 main benefits of Instarisa. One is the 3D facial scanning and the software that you can incorporate into programs like exocad. So you can design a smile based on the proportions of the face. It's been instrumental in our practice because instead of doing 4, 5, or 6 sets of teeth, that costs a lot of money. You lose a lot of money doing that. Now we're able to do 1 or 2 sets of teeth per patient. And why? Because the first set's so perfect already. And so perfect proportions. It's also an alternative to photogrammetry. So there's a pickup technique where you don't need photogrammetry, but guess what? At the Atlantic Implant Institute, we teach how to use both together or separate. So the doctor has choices of which way they want to go.
Are you teaching, what about those dentists that don't want to make the big investment to have all of their own in-house lab?
Oh, absolutely. Because, I didn't start with this big giant lab, and like $2 million of equipment. You got to start somewhere. So I talk about your avenues to creating an in-house lab, whether you want to do design in-house or, mill in-house or design outside. There's different ways you can do it. And it's all about your comfort level. You don't have to do it all there. You can piecemeal the amount of laboratory work you want to do. It's all about your efficiency, your workflow, and your comfort.
So this isn't just for the beginner, but the beginner could go.
Absolutely.
But yeah, the advanced guys, and I've met a lot of them on my show, but they're not doing that 3D scanning.
Right. There's a lot of different experience levels out there, and our courses are tailored for all of them. We have beginner guys come to the full arch, full digital workflow course, and it's not a course designed around surgery for all-on-4, but guess what? They're all gathered around, taking pictures of the setup, noting what the assistants are doing, how they're all interacting, because maybe they've only done 1 or 2 or 3 or 5. So they want to see how that workflow goes. There's so many intangible benefits to taking our classes. You know why? Because our team is there, and you can ask administrative questions, you can ask assistant questions. There's just so much knowledge to be gained from coming to one of these courses.
Now, I don't go to these courses, but how is it different than what's already out there? Or is it different?
Well, I understand through, corporate groups that have come in. Neodent's been there, Stella Life, Voxel Dental, Sprint Ray, and they say that they have not seen a course anything like it. With the facility that we have, as modern as we have it, all the equipment's right there. We're not just talking about different equipment, in a PowerPoint presentation. We're demonstrating it and showing it with live patient demonstration. The word we get, the feedback I get, is that it's a one-of-a-kind, unique program in this country.
Good. Now, where do they go to sign up, or at least to learn more?
So go to our website, theatlanticImplantInstitute.com. You can check that out. Check out the Instagram. You can send us a message or just give us a phone call, and we can give you a schedule of dates.